Good afternoon. This is Dr. McDaniel at GYN Corner. I'm a board-certified obstetrician gynecologist in New York City, and I'm bringing to you all things health-related for women. Thank you for joining me here at GYN Corner. Today is Tuesday, October 15th, and as the title stated, I'll be speaking on ovarian cyst. Please check out also the YouTube channel. It's called GYN Corner, and we have podcasts on 8 different platforms called GYN Corner, Podcast Addict, Google Podcast, Apple iTunes, Spotify, Anchor, all of the usual haunts for GYN Corner. So today I'll be speaking on ovarian cyst, and I also put as an adjunct that it's hormonal. Sorry, and that's because a lot of people think there's just one type of ovarian cyst. So they say, oh, I had an ovarian cyst, and then I ask, did the doctor say what kind of cyst you had? And they're like, no, it's just an ovarian cyst. So I wanted to indicate that I'm speaking about hormonal ovarian cysts today. I'll discuss what that means, and then in future broadcast or presentations, I'll speak on the different types of ovarian cysts that are possible. So a cyst is a pocket of liquid or a pocket of fluid. One can get a cyst anywhere in the body. You can get cyst in your mouth, cyst in your intestines, cyst in your brain, cyst in your heart, your lungs, uterus, cervix, ovaries, everywhere. So anywhere where you can potentially have an abnormal growth, which is a tumor, you can have abnormal fluid collection, which is a cyst. And ovarian cysts are pockets of fluid on the ovaries. You can have the pocket of fluid project from very superficially out as kind of like an appendage or a doorknob from the ovary, or it can build up inside the ovary and fill the entire space of the ovary and just push the ovarian tissue itself out to a thin layer on the walls or the outer lining of the cyst. Cysts can have different presentations. They can be clear, watery, or they can be filled with blood, or they can be filled with different types of body tissue or body fluids. So hormonal cysts are cysts that are produced due to natural hormonal functions of the female reproductive system. And everyone who's not on a birth control that prevents ovulation, if you're just natural or if you're on a well, actually it doesn't matter. If you're natural or if you're on an IUD, then if you're normal reproductive age, normal functioning female, you will ovulate. And if you ovulate, you'll get 2 cysts every month. Those are hormonal cysts, so they come and go according to the menstrual cycle. So you'll get the first cyst, which is a follicular cyst, and the second cyst replaces the follicular cyst. That's called a corpus luteal cyst. It's also called a hemorrhagic cyst. And the follicular cyst is a pocket of liquid that develops according to hormonal influence to produce an egg so that one can get pregnant to allow for fertility. So an egg in medicine is called a follicle. So it's a follicle or an egg that's produced, and it's produced inside a pocket of fluid in the ovary. That follicular cyst will develop until ovulation occurs. And with ovulation, the hormones allow for the full maturation of that follicle or that egg. So usually the cyst will get between 18 and 22 millimeters. So about, I don't know, the size of a peanut maybe, or a macadamia nut even. So it'll get to around 18 to 22 millimeters, which is about also about the size of a little less than an inch. So anywhere from a half an inch to an inch. So that cyst develops to produce or to formulate an egg so that one can get pregnant. When that egg is fully matured, that cyst will rupture, or it'll pop, or it'll burst. Now, a lot of times women come into me, they've been sent to me from the emergency room where they were told that they had a ruptured cyst. It sounds horrible. A ruptured cyst sounds horrible, sounds really scary. And so they're told, you had a ruptured cyst, follow up with your GYN doctor. And I have to tell them that even though you don't have pain every single month, you don't go to the emergency room every single month, you're not on birth control pills. So you have a cyst that ruptures or bursts every single month when you ovulate. Some women always know when they ovulate because they can always feel a little twinge of pain, either in general in the pelvis or on one side or the other. They'll say they feel a twinge of pain or they feel cramping, and it's always mid-cycle, 2 weeks or so before their menstrual cycle, so they know when they've ovulated, and they know sometimes on what side of the uterus that they've ovulated, the right side of the uterus or the left side of the uterus, depending on which ovary produced the egg. So it's normal to have a cyst first part of the cycle, and it bursts or ruptures to produce or release the egg so that it can be fertilized for pregnancy. And under normal circumstances, the amount of fluid that develops inside that cyst is so small that most people won't feel it, and then it will get absorbed or soaked back into the body tissues. If someone feels it, it's usually going to be larger than 2 centimeters or about an inch or so or larger. Now, that cyst can get quite large. It can get, on average, up to 5 centimeters is considered normal. So 5 centimeters is going to be about the size of a tangerine. Now, if someone gets a cyst that's about 5 centimeters or tangerine, when that bursts or pops open to release the egg, it's going to be quite painful. That's a lot of liquid that's released. And every blue moon, even though it's a normal cyst because it's producing an egg or a follicle of the ovary, sometimes it will become abnormally large. I've seen patients or women who have had a normal follicular cyst develop. It's gotten up to 10 centimeters. So it's gotten up to the size of a newborn baby's head or the size of a grapefruit. Now, when that bursts, it will be horribly painful. It's equal to someone with a bad appendicitis symptoms. Their appendix produces fluid when it's inflamed, and that fluid irritates the lining inside the pelvis. That's the same thing that happens when you have a follicular cyst that ruptures or pops or bursts. That fluid irritates the lining, and it will be horribly painful. They'll have pain when they move, pain when they walk, pain when they lie down. It'll go all the way up to under their diaphragm. They'll feel shoulder pain. Anytime they cough or sneeze, or any kind of jarring will induce a lot of sharp stabbing pain because the fluid is sloshing around in the pelvis. And the treatment for that, we call that symptomatic follicular cyst or symptomatic ovarian cyst. The treatment for that is going to be thyme, so tincture of thyme, pain medicine, ibuprofen, nonsteroidals, Motrin, and then just allowing the fluid to get absorbed. We don't operate on women because it's a normal cyst that pops, and it will normally get soaked up into the body. The cyst inside a follicular cyst is clear water, so we call that serous liquid. It's straw-colored or clear-colored watery liquid. Sometimes it'll be blood-tinged if a small capillary bursts with it, so then we call it a serosanguinous fluid, so blood-tinged, clear, watery, straw-colored fluid. It gets absorbed into the body. It's not a big deal. So that's the cyst that allows one to produce an egg in order to get pregnant. That cyst is then replaced with a second hormonal cyst, and that second hormonal cyst is called a corpus luteal cyst or a hemorrhagic cyst or a hemorrhagic corpus luteal cyst. So we have 3 different names for the same cyst. That's a hormonal cyst that is produced in the second half of the cycle after ovulation, and it produces the hormones that cause premenstrual symptoms, so breast tenderness, bloating, appetite change, irritability, all of that. And it produces progesterone to support a potential pregnancy. That corpus luteal cyst, if someone gets pregnant, will stay until around 11 weeks of pregnancy, when the immature placenta can produce enough of that progesterone hormone to maintain the pregnancy. If someone doesn't get pregnant, then they will get their menstrual cycle, and that corpus luteal cyst, which is pocket full of blood, basically that's why it's called a hemorrhagic cyst also, because it's just filled with blood. That cyst will shrivel up and kind of involute and eventually just shrink away, and it leaves what we call a white body, which is the corpus luteum. It leaves a little, looks like a scar tissue on the ovary, and that's the remnants or the remains of that cyst. So the corpus luteal cyst is another hormonal cyst that always should be produced after the first cyst, the follicular cyst that produces an egg. After that first cyst pops or bursts, the second cyst replaces it and produces hormones to cause PMS, and if someone's pregnant, to maintain the pregnancy. So those are two normal hormonal cysts that should occur every month and should occur and then go away. Now, every once in a while, less than 10% of the time, 8% of the time or so, those cysts don't go away. And of course, we have a name for that. The name is called a persistent hormonal cyst. So, persistent follicular cyst or persistent corpus luteal cyst. More commonly than not, the cyst that will persist or not go away is a follicular cyst. So sometimes someone will get a sonogram or imaging study, we'll see one of those cysts, we'll tell them to come back in not a month, but in 3 to 4 months and repeat the sonogram to see if the cyst is gone, because if it doesn't go away, it will usually go away every month. But if it doesn't, then it will often go away by 2 to 3 months. If it doesn't go away after 3 months, then we'll say it's a persistent hormonal cyst, or we also call them functional cysts, because they allow the reproductive system to normally function. So if that functional cyst does not go away within 3 months, then we'll say it's persistent. And as long as it doesn't increase in size, it just sits there, or it shrinks a little bit but doesn't completely go away, then it's not a big deal. And every blue moon, I'll see an older lady in her 60s, 70s, or even 80s. We'll do a sonogram for maybe pain or a question of something going on, and then we'll see an old follicular cyst or an old corpus luteal cyst just sitting there, and we know it's been there for a good 10, 20, 30 years because she hasn't had menstrual cycles in that long. We don't get excited. No one jumps up and down. It's not a big deal. We'll usually do a repeat sonogram, though, to confirm that it's still stable. Nothing's changed. It's just sitting there. And then after that, every once a year or every couple of years to make sure nothing's changed. We don't operate on it even then, because a concern for ovarian cancer is not going to be high on the list. It's just sitting there. So I hope that's been helpful information on hormonal ovarian cyst, or what we call functional ovarian cysts. Those are normal. They're supposed to come and go. If they don't go away, it's not a huge deal. We just monitor it, make sure it's not changing. And the treatment, if someone's having a lot of problems with them or they're tired of getting sonos, is just to go on birth control pills. Birth control pills will quiet the ovaries. You don't ovulate on birth control pills. There shouldn't be any ovarian cystic changes on birth control pills. So if someone's having horrible pain or lots of symptoms, go on a birth control pill, quiets everything down, solution solved, resolved, everybody's happy. So I hope that's been helpful information on functional ovarian cyst or hormonal ovarian cyst. Thank you for joining me at GYN Corner. Please hit the follow button. Please hit the subscribe button on YouTube. Please click the like button if you enjoyed the topic today, so I'll know to bring additional topics in this vein to the GYN Corner. Please ask questions and give me suggestions for content, for things you'd like to hear about and questions you'd like answered. Let's see, Miss Fogel put a question about Parlop. I've never heard of Parlop. It's Parlop. So if you're listening to this, please let me know what you mean by Parlop. It's nothing that I've encountered in GYN or in medicine, but maybe it's something that people are talking about in the streets, people in the know. So if anyone else knows what Parlop is, Parlop, let me know, and I can look into it and address it for you. Thanks for watching. Have a great rest of your Tuesday. Bye.